Welcome. Just as a reminder, as you come in to sign into the meeting, you can do that on your agenda, or there's a QR code on the screen. Make sure you grab some pizza also. Hello, SNA friends. It is good to see you all. I have missed you over the holidays. I hope everybody had a great holiday season, and we are ready to hit the ground running this year. I'm really excited about today's speaker. His name is Dustin Pugel, and I pronounced the name right? Did it right? There you go. So he's not going to start right now, but I want you to start thinking about it. He's the policy director for the Kentucky Center for Economic Policy, and he's going to be sharing with us today policy and economic changes that have come from our federal government and state government that are going to start impacting all of our clients this year. As you can imagine, it is going to be nothing but great news. That was my ironic joke. I should have delivered it a little bit better. But I guess it's not funny. That's why we're not laughing, because it's not funny at all. It's awful. So what I want you to start thinking about, he has an awesome presentation, but I talked to him before this, and he's like, Aaron, there's so much. I could present for 2 hours on this, so I just couldn't share everything. So he has stuff he's going to share, but I want you thinking about if there's something that might impact your industry, or that you've heard about, or that you have questions about. Start thinking about that now, so when we get to Q&A session, he's able to address those. Sound good to everybody? Awesome. Well, we're glad you're here. If it's your first time here, we're especially glad. We're going to ask you to introduce yourself in a minute. Few things that I want to go before we talk about the mission. I'm just messing Jared up back there. First, Jarrett Mueller, our first full-time employee for the Safety Net Alliance. If you don't know Jarrett, I hope you get to know Jarrett. I got to know Jarrett well. Jarrett, way back in the beginning, worked for the Brighton Center and did some work for the Safety Net Alliance. Then he went to Code Kentucky and was on our executive committee for a long time. And now he has jumped into the deep waters of working for all of us full-time. So we are excited to have him. We talked about this a lot last year. We knew for us to be what we knew we could be, we needed somebody that could give their full attention to this organization and support it. And so we were so lucky to get a grant from the United Way so that we could fund Jarrett's position. His new email is jarrett.mueller@nkadd.org. I know we're not the NKADD, but they are our fiscal sponsor. So that's who he has his email through. We'll probably get one set up for the Safety Net at some point in time, but that's what you can email him at now. His role is multifold. First and foremost, is to get Care Suite up and running. We talked a lot about Care Suite last year. We are 100% committed to this. If you don't know what it is a collaborative case management software that allows us to work between agencies on case management for clients. It also allows us to send active referrals between agencies that are much more improved over past ones. So rather than having to give a phone number to a client and say, call here, call here, call here, we'll be sending that information to that agency with the client's permission. It will have our client's documentation. It will have all their information, so we'll be able to skip over a lot of our qualifying details when we bring in a new client in. And we believe with this collaborative environment, we're going to be able to push Northern Kentuckians who are struggling to thriving a lot faster. So Jared is heading up that initiative. Know that we'll be opening that up for other agencies in the not too distant future. So if you're a leader, be thinking about how you can implement at your agency. If you're not, be talking to your leaders about how much better a system like this would help your life, whether that's on the referral end or the receiving end. Also, I'm excited to step down as your board chair, and Kay Stevens is taking over as your board chair. I don't know that Kay is here today, but she's going to do an awesome job. So between Jarrett and Kay, they're going to be crushing things and taking us to the next level. Okay, that's all the little announcement things. Let's go over. Why do we show up? We show up because we know that together we're stronger than we are separate. We know that anybody that needs services in Northern Kentucky probably needs services from more than one of us. None of us solve everybody's problems. So we believe it's important that we get in the same room, that we get to know each other, that we understand what each other does, that we build relationships, so when we have the person sitting across from us, we're able to help get them connected to other services and advance their lives. We also work together to identify where are we falling short, where are the holes in the safety net, and how do we come together to address those. What do we want to do? Why do we want to do this? We want to build a resilient community where every person has an opportunity to thrive and enjoys equitable access to essential services, support, and opportunities as a springboard to a brighter future. So we love that we get to do that. We do that through literally every person sitting in this room. The only way we can accomplish that is if we all put it on the forefront of our mind. So thanks for being here. So I think now we're moving on to first-time attenders. If it's your first time, we want to know you. And I know you're probably sitting there saying, I don't want to stand up in front of a group. And I get that. But it's so important that you do. Because the only way we can start to work together is if we know you. So my hope is that you'll raise your hand here in a second. You'll tell us your name. You'll tell us your agency. You'll tell us what your job is. And if there's anybody here that you're like, man, it would really be helpful to know somebody in this industry, tell us that too so that that person can find you as we wrap up today. Sound good? So if it's your first time, raise your hand. And my lovely assistant, Andy Brunsman, Dana Brunsman is going to walk around.
I look good today, man. I'll take you.
I know.
I'll second that. You look great today. And thank you for stepping up to the plate and taking your position. My name is Melissa Adams, and I work for Brighton Center, and specifically at the Center for Employment Training. We are looking for humans that are seeking job training, certification in a program 2 years or less. We offer a couple cohorts that go hand in hand with that. So I'm going to start with the cohorts. The cohorts are a Trace to Success program run by Ben Burton. I'll have flyers available. We also have a Bridges to Healthcare. If you have a client who is just not sure if a healthcare position or training would be up their alley, they can come and take a cohort, actually get paid for the cohort. It's a short period of time, about 4 weeks. If they attend every meeting, they can collect that stipend. I specifically enroll in the healthcare field. MA, medical assistant, it's 1,070 hours. Healthcare technology administration, it's 1,000 hours. So that is a 6-month investment in your client's time to be getting certified, and graduation is job placement. And they're also offered the Brighton Center resources such as a success coach, a career coach, and my position there is strictly enrollment and engagement with the trainees. But thank you so much for welcoming me this morning, and I look so forward to working with Faith Pharmacy moving forward.
Awesome. Who else is new today?
I got a bunch over here, Aaron.
Okay, I'll start moving around with you so we can be efficient.
My name is Jenny, and I'm an HMS intern at Gateway's Food for Thought Pantry.
Welcome, Jenny. We're glad you're here.
Hi, everyone.
I'm Sarah.
The props, keep it. We'll go to you next. Go ahead.
You want me to go?
Okay,
Go ahead.
sorry. I'm Sarah. I'm a Gateway intern at the food pantry as well, and I'm open to meeting everybody.
Hi, guys. My name is Annie. I work at the NKADD, the ad, and I am a case manager and a job coach. So basically what we do is that we help clients who are going through SNAP and KTAP kind of go through the work process to be able to place them somewhere and just help them with that work requirement. So if you have any ideas about that, please come find us after. Thank you.
Thank you. That's going to become critically important as we move through this year, even more than it was.
Good afternoon. My name is Carol Lucio. I'm with SAD, Students Against Destructive Decisions, formerly Students Against Driving Drunk. I am the regional manager. I cover all of the state of Kentucky plus, and I am looking to connect with anybody that works with youth in prevention. I'm specifically planning for pre-prom safe and healthy messaging for this spring.
That's awesome. I have a 16-year-old boy. All he does is make destructive decisions, it feels like. Who else is new today? Oh, right there. I thought you...
Hi, I'm Alicia. I'm with ESNKY. I am our navigation coordinator. I meet with all of our guests within 24 to 48 hours of them coming into the building to see what community partners we can work with to get them the resources that they need. And I would love to meet anyone in here that could help my guests get to their goals and get to a better life.
Hello, my name is Sarah O'Malley. I am here with Caring Excellence, which is an in-home care agency. We're able to help individuals stay safe in their homes with some assistance.
Good afternoon. I'm Deacon Barry Henry with the Diocese of Covington Catholic Charities. I am the new Director of Community Ministries and Outreach, and yes, that's a mouthful. So that includes Parish Kitchen, Pickett's Corner, which is our bicycle ministry, jail ministry, and mobile food pantry. So thank you. I'm just looking forward to meeting everybody.
Thanks, Barry. Barry's a great guy. I got a chance to have lunch with him. I made a lot of destructive decisions, too.
Hi, I'm Stacy. I'm from Brightview. I'm a case manager there. One thing a lot of our patients need help with is transportation, felony-friendly, anything, housing, furniture for housing. So, yeah.
Awesome. Anybody else new today? Oh.
I'm Courtney Fugate. I am the Payee Service Coordinator with Welcome House, and I'm looking forward to meeting everybody.
Thank you. Does everybody know what a payee service coordinator does? Okay. Some people don't know what it is. I didn't know what it was until I was on the board of the Welcome House. I know they do a lot, but I was just making sure everybody knew what it was. Anybody else here new today? All the way back there in the, oh, you already got one.
Hi, I'm Ren. I'm the Youth Services Coordinator at Brighton Center, and that includes the Opportunity House, if anyone's heard of that one, the after-school clubs with the social and emotional learning, the YLD, and introducing, we have a youth street outreach team that is now launching, so that is really exciting, and all of those homeless and unhoused youth resources, definitely get in touch. Yes?
That's awesome. Great work. She said, let's connect. She wants to talk to you afterwards. See, that's why we show up.
I'm Alan Simpson. I'm with the Brighton Center. I'm one of the Youth Street Outreach team members. And today's my first day. I don't know anything, so reach out. Yeah.
We're going to get you educated, man. You'll learn a lot here. Thanks for being that. It's an important job.
Hello, my name is Tiffany. I'm with Northern Kentucky Community Action Agency. I run the Duke Plus program. We offer a class. If they attend the class, then we help with a Duke bill.
That's huge. My Duke bill, did everybody else get an email last month saying, hey, your Duke bill's going to be high. Remember it was cold? And then I got my Duke bill and I was like, I don't think this was just because it was cold. That was a lot more increase than because it was cold. Anybody else new here? Well, we're so glad that you're here. Thank you. Reminder to everybody, friends and colleagues, the more we have in the room, the more problems we can solve, the more we can help people that we work with. So thanks. Let's move on to committee reports. I will start with the executive committee. Big things are that we hired Jared, that Kay's taking over as the chairperson now, and we are working on our strategic goals for 2026. That will include Care Suite and getting it up and running and vibrant. We're also waiting on another grant that we asked for from the United Way. We're really hoping that we get that. It's going to help us do back-end data work off of Care Suite, which hopefully will give us early indicators as to when we're identifying holes in the safety net and where we need money to go. And then we can work collaborative as a group to work with funders so that we can funnel money to where it's needed to make sure that we're getting all the services. So some exciting stuff there. That's really exciting. Anybody from service integration here? No, they're taking over Care Suite. So they'll be leading Care Suite along with Jarrett, and they're going to be taking over that and working on that. What about member engagement? I know we have people from member engagement here. Well, you're closer to me, so I pick you.
Hi, everybody. So for member engagement, we're working on Safety Net 101. Hopefully we'll have that out and ready to go in the next couple of months. And then we also look for speakers to present each month. And we have a list of what our topics are. I don't know them off the top of my head, but sometimes you'll get calls, you'll get a request from us for a speaker. So that's it. And also just wanting to make sure that you feel welcome.
Thank you. What about external relations, Mr. Brunsman?
The Facebook page is up and running. Thank you for people who are posting. We don't have a ton of activity yet, but we do have a few people, so thank you for utilizing it. Remember, if you signed up for the page but aren't seeing anything, it's because you did not answer the qualifying questions. So unfortunately, our group, if you don't answer the 3 questions of like if you're a staff member or a volunteer, what agency you're with, you can't get in the group. You have to at least answer those. I think it's 2 base questions. We are going to have a meeting, which is terrific because we've been waiting for a long time, so you guys will have an alert for this. But February 18th at 12:30, Be Concern's going to host in our new boardroom. We're going to get the External Relations Committee together again. There'll be some new faces there. Please join if you haven't. And then I think I want to connect with like Kentucky Nonprofit Network, some of our other friends, to try to see if we can get like a regional presence for someone who can maybe help us be bigger represented with all of what's going on within the Commonwealth with a myopic lens of Northern Kentucky. A lot of the battles that a lot of us are fighting now are actually coming out of Frankfurt and not locally, and we need to have more advocates down there to help us, 1, understand the business landscape, and 2, do that. So we're hoping to maybe get a little help from folks like you and our friends at KNN who can come with like a much higher level knowledge than we have to trickle it down. But you'll have an alert for that. Please RSVP, and I hope to see you there.
Awesome. KNN did announce, and he has started, that Ryan Salzman is going to be their regional advocate for Northern Kentucky. Yep. I know I'm meeting with him later on this month. If you don't know Ryan, he's a great guy. He was in city government down in Bellevue, really smart guy. I think he's going to be a great asset to the region. We're looking at how does the safety net partner with KNN, partner with Ryan to ensure that all of our voices of things we see on the ground are lifted up when it comes to legislation at a local and state level. So it's good stuff, and that team's going to be really important to it.
And we're trying to create a triangulation between the safety net, like the Kentucky Nonprofit Network, and the chamber, so we can kind of hit those 3 big things, because the connectivity all of us need kind of come through those 3 triangles, right? The service sector, the government sector, and the policy sector. We got to find a way to get those all communicated with each other.
Absolutely. Thanks, man. Community impact. I saw Jenny was here today.
Hello. So with Community Impact, we've taken a little bit of a break, but we're going to be getting together with the new year. So last year we spent a lot of time talking about how we celebrate the impact the safety net does across the community. We came up with some ideas for some awards. Hopefully we'll be moving those forward coming soon. And then in the upcoming year, we're going to also be looking at how we're sharing data. So some of that will come from Care Suite as we push that forward. And then program agreements. We used to have MOUs with different programs across the Northern Kentucky, and we're looking forward towards actually doing program agreements. Is that correct, Aaron, instead of MOUs?
That's correct. Yep. That's awesome. Thanks, Jenny. Remember, you can all join any of these committees. You have to get elected to an executive committee, but any of the rest of these you can join. There are QR codes on the back of your agenda today. We always need more people. The more voices we have, the better we're going to be. There's also a QR code on the back of your agenda for affinity groups. I'm part of the healthcare affinity group because I'm in healthcare. We meet monthly on a Zoom meeting for an hour, and it is one of the most valuable hours of my month. I learn about everything that's going on. We talk about what are the challenges we're seeing in our industry right now. We talk about how can we team up to face these challenges. So we have those in a lot of different sectors, from food to healthcare to seniors to housing to a number of things. So look on there. If you see one that hits your industry, we'd love for you to join. There are a couple of those that we're trying to get stood up. The only thing that's standing in our way are leaders. So we just need somebody to raise your hand and say, hey, I'll send out the appointment every month. And we actually already have a meeting agenda for you. So you really don't have to do much. But I know we need that in students, and I think we need that in seniors. So if anybody's in the room that would be willing to do that, we'd be grateful.
I'm going to interject with the food committee. The food committee's been a little dormant as we haven't had a ton of work to do. Alert will go out, but February 23rd, again at 12:30 at Be Concerned, we're going to try to convene some of the members of the safety net food team. So Sandy will get an email from me. There is work being done. We know that Horizons has released some funding to a lot of us safety net partners, 20 of us in the room. but I think we're going to try to reimagine the food committee to maybe be a 3 or 4 times a year meeting so we can go over meaningful things, right? Like there's only so many loaves of bread to share, we know that, but there are larger policy-based things that I think we need to be paying attention to, especially numbers. And so we're going to try to build the food committee with feedback from like Free Store, Be Concerned, a bunch of people on the, come up with a meaningful agenda like 3 or 4 times a year we can come over and realize we're never going to create more food, but figure out how do we share and all those fun parts.
Sounds good. And create more food, Andy. Just create it. Okay, with that, I'm excited. Oh, Andy, you have never been light on dreaming, and it's what I love about you. You've never been light on dreaming, and it is a beautiful part of who you are. We must dream. Okay, with that, I'm going to introduce Dustin Pugel. I'm excited to have him. I think he's going to have a lot to share. Hopefully, you've been ruminating over some of those questions, and I'll invite you up. Please help me welcome Dustin.
To share. We'll see. All right. Well, hey, everyone. My name is Dustin Pugel. As you heard, I'm the policy director at the Kentucky Center for Economic Policy. We are a nonprofit. We're a 501c3 nonpartisan organization that does a lot of research and advocacy around a lot of different policy issues here in the state. So we kind of focus on 3 major buckets. One is tax and budget issues. Another is anything that sort of interfaces with the criminal legal system. And then finally, what we call economic security, including the safety net, which is something that I primarily focus on. Also, I'm really amazed at this coalition. This is really great. I love this network here in Northern Kentucky that focuses on, services to folks who need some help. I also help co-lead a coalition that is not direct service oriented, it's still advocacy and policy oriented, but it's called Thrive Kentucky. Anybody been to a Thrive Kentucky roadshow? Yeah, okay, all right. Well, I'm sorry in advance, some of this will be familiar to you, but you also know that it's like drinking from a fire hose. So we're going to get into it a little bit today. I'm really going to focus on a handful of policy areas, but I think everyone in the room is really aware that there's a lot of shifting sand right now. I'm going to focus a lot on Medicaid and SNAP, but housing policy is changing a lot. Child care policy is changing a lot. There are changes that have happened recently to KTAP here in the state. I heard somebody mention that earlier. So I'm going to focus on a couple things, but if you have other questions about policies I haven't talked about, or if you hear there's intersections, please raise your hand and just jump in. I'm not at all offended. I like having conversation. And likewise, if you have a question about what I'm talking about, as I'm talking about, you don't have to wait till the end. I'm happy to answer as we go. So let's go ahead and start out with something that this is probably like the biggest no-duh slide that I have today. But things have gotten more expensive lately, right? There's a catchphrase or a buzzword that has been making the rounds a lot lately called affordability. But affordability is just really, the cost of living, right? What's it take to get by on? And in a lot of ways, can you go back a slide? There we go. In a lot of ways, everything's gotten more expensive, right? Transportation's about 36% more expensive. Shelter, so housing, is about 33% more expensive. This is all compared to 2020. Energy and food are more expensive. Childcare was already expensive, but it's increased. Tuition has increased, especially as federal funds have dried up. And medical care has gotten more expensive. So to the extent that folks need help, that has really only grown over the last several years. If we go to the next slide, it would be one thing to say things have gotten more expensive, but wages have kept up, but they haven't. We know that the median household income has fallen when you adjust for inflation over the last several years, and so have median wages, the hourly wage. It is actually less now than it was before once you factor in inflation. So if we go to the next slide, What we also know is that, again, a pretty big no-duh slide. If you have kids, it's harder to get by, right? You need more space, you need more food, your transportation needs increase, shuttling them back and forth to events and soccer games and all that. And you have to pay for childcare. So, if we think about what the median family income is, these gold bars, that median, meaning, this is what half of Kentuckians earn, right? It's the midway point for all Kentuckians. It's not enough to keep up with, 2 adults and 2 children. These are three random counties, not Muhlenberg and Fayette. But if you go to, there's several different family budget calculators out there. There's the EPI family budget calculator. MIT actually has their own sort of family budget calculator. And we have a map where you can look at sort of different scenarios based off county. But in all these cases, if you have a couple of kids, it's really hard to get by. And this is if 2 parents are working. If only 1 parent is working, it becomes much more difficult. So, that's kind of our starting point, right? It's really difficult for a lot of folks to just make ends meet. And so we have all these programs, and you all work very closely with all these programs, so you don't need me to tell you about them. But I'm going to start by talking about Medicaid, because it's the biggest, by far, in our state. This is a program that covers just under 1.5 million Kentuckians. It's a little over 1.5 million if you include kids on K-CHIP. That's around a third of the state's population. In some counties in southeastern Kentucky, it's much, much higher. Here in northern Kentucky, it's a little lower than a third. This coverage is really pretty amazing. It's cradle-to-grave coverage. So it covers 40% of births. It covers 60% of kids in Kentucky, 70% of nursing home residents. It is a really powerful tool that covers a broad array of folks, including people who have developmental intellectual disabilities, who are sort of mechanical dependent for living, through something called a Model 2 waiver. It covers hundreds of thousands of working Kentuckians, people who don't earn enough to be able to buy their own health insurance on the marketplace, but are also not offered coverage at work. It's also one of our largest, if not the largest single state spending item that we have. It's about $20 billion. Of that $20 billion, about $3 billion is what are called general fund dollars. These are monies that we raise through our tax system. I'm going to talk a little bit about that later. But it's enormous. It's a really significant program that helps a lot of folks and supports a lot of jobs in the state. If you look at just payments to providers in eastern Kentucky, for example, through Medicaid, no other health program, just Medicaid, and you look at just payments to providers in eastern Kentucky, it makes up 13.5% of GDP there. So it's very significant. And I'll come back to that in just a minute. But we know there was a big bill passed, right? H.R. 1 this summer was passed by Congress. They call it the One Big Beautiful Bill Act. This bill is going to have pretty severe cuts to Medicaid as well as some other programs. And I'm going to talk a little bit more about those in detail, but just a quick look. It's estimated that about 210,000 Kentuckians will lose Medicaid coverage and not find coverage elsewhere. In addition to that, there's another 10,000 folks that we know of right now who opted out of coverage on Connect, our state-based marketplace. That open enrollment ended last week, and so we're finally getting some hard data on this. But so far, we know 10,000 folks have actively opted out. We'll see how many people actually what's called effectuate coverage, which means make their first premium payment. But if that holds true, then what we could see is a really significant rise in our uninsured rate. And if you don't have health insurance, you don't need me to tell you how bad that is for you, right? There's all kinds of research that showed that coverage is actually really beneficial for your well-being, and not having that coverage is a problem. All right, if we go to the next slide. I'm going to zoom in on a few of the provisions in H.R. 1 that are going to be implemented or have already been implemented, and we'll talk a little bit about a timeline later. But, there's these paperwork barriers that are going to be implemented. There are cuts in payments to providers that are really significant. And there are cost shifts, both cost shifts in the state budget, but also cost shifts from people who are on Medicaid, a new co-payment program that we're going to have to wrangle with. So if we go to the next slide, just to start out, the biggest one is related to work reporting requirements. Now, work reporting requirements have never been a part of the Medicaid program before. Medicaid was conceived of as a health coverage program, right, for initially the elderly and children, and over time new populations have been added, most recently through the Affordable Care Act back in 2010 when we added all low-income adults. And that's where that initial plummet in our uninsured rate came from. The work reporting requirements, though, are going to mirror what has been happening in SNAP for a while with a few caveats. So, folks are going to have to report 80 hours of work a month in order to remain qualified. This applies to anyone aged 19 to 64 years old who don't have a documented disability and don't have children aged 0 to 13. So if you have a kid 14 and older, you'll have to adhere to this work reporting requirement. The other thing about this requirement that's actually a little different from the SNAP one is that you're going to have to prove that you were working a month prior to application. So it's not like you can apply, get coverage, and then start working. You have to have already had 80 hours going into this. There's one state that was able to implement something like this early. That was in Georgia through a program called the Georgia Pathways Project. And right now, they have about 8,600 out of 240,000 estimated eligible Georgians participating in that program. So what that tells me is it's actually a pretty big barrier in order to get covered, let alone stay covered once you have that coverage. But states have a lot of control in how it's administered, and I'll talk a little bit about that later. If we go to the next slide, I just want to say a couple things about Medicaid enrollees. And again, this is data that I'm sure reflects a lot of what you all see on a day-to-day basis. But the vast majority of adults under 65 on Medicaid are working, right? So if we look at those who are working, this blue bar, the dark blue bar is full-time, the light blue bar is part-time, and it's 51% are actively working in some kind of a job through the year. This is data from the current population survey. If we look at the rest of them, we've got about a quarter who are ill or disabled, and in theory they would be exempt, right? Because remember that we're talking about non-disabled folks as long as they're able to prove that they have a disability, which is a whole other issue. About 10% are taking care of family. Like a lot of them are likely taking care of kids, but some of them may be taking care of an elderly loved one or someone with a disability or an illness. About 5.5% are going to school. In fact, I talk to a med school class every year about this, and without fail, 3/4 of the med students in the room are actively enrolled in Medicaid because they don't earn any money, right? They have no income, but they need some kind of coverage, and the coverage that the university provides isn't as good. So they go to Medicaid to be able to provide their bills so that they can go and take care of other people. About 3.7% claim they're retired, and the rest are either they can't find work, but they're looking for it, or some other reason that the survey couldn't identify. The other thing is we're talking about, I think a lot of times when we talk about people who are on Medicaid who aren't working, we're thinking about folks who are, in their 20s, maybe playing Xbox in their parents' basement, that kind of like image that I think a lot of people conjure. In reality, the data says that the average person who is not working and on Medicaid is a 44-year-old woman who's likely taking care of someone and works off and on throughout the year. And I think that, it's much more realistic in a lot of ways. About 73% of those folks have a high school degree or less. 27% don't have anything beyond high school. So there's some other ways that eligibility is going to be cut through H.R. 1. There's a doubling of the number of times people have to prove their eligibility if they're on Medicaid expansion. This may not sound like a big deal, but what we found when there was the, people remember the public health emergency unwinding a couple years ago? Yeah, it was a huge deal, right? We had to restart coverage for about 1 million adults. And we're just wrapping up that first round of redeterminations for kids now. And what we found is that 60% of the people who were disenrolled were not disenrolled because they were found ineligible. They were disenrolled because of procedural errors. Procedural errors are missing paperwork, late paperwork, data that didn't match up with existing data sources. And so it wasn't that we checked their status and found that they were ineligible, it's that they just messed up, right? It was typos or bad paperwork. That's what we're concerned about primarily with the doubling of the eligibility checks. Most immigrants will no longer qualify. There was a pretty broad list of immigrants that were removed from eligibility through H.R. 1 as a part of sort of the broader activity related to immigration in our country. I'm trying to be nice. So that is that's a pretty significant change. We think somewhere around 2,000 refugees lost their Medicaid because of this in Kentucky. There's also going to be payment cuts. So I'm going to talk about this a little more in a little bit, but if I mention 35 hospitals, does that ring any bells for anybody? Yeah, okay, all right. So the reason these hospitals are at financial risk, and I promise I'll talk a little bit about this more, is that we're going to reduce how much we pay them in a couple of different ways. Well, really one way, but we're going to reduce the way we get the money to pay them too. So right now what happens is we tax hospitals a certain amount of money. We use that to draw down additional federal dollars that's actually more than the amount that we're taxing them. And then we send those to hospitals as supplemental payments. Those payments make up the difference between Medicaid reimbursement rates, which are pretty low. Yeah, I'm seeing a lot of heads nod in the room. And the average commercial rate, which is actually pretty decent, and it's above the sort of operating margin for hospitals. We've been doing this for about 5 years now. It's grown pretty significantly. Those payments that we make are called state-directed payments. They now make up about a quarter of the Medicaid budget. So if you all remember, I said the Medicaid budget's about $20 billion right now. Those state-directed payments are $5.5 billion of that to hospitals. So that's an enormous amount of money that we are going to have to start reducing because, first of all, we have to reduce the amount that we're taxing hospitals in order to draw down those federal dollars. And then, with that smaller amount of money, we also have to reduce what we're actually giving them in those state-directed payments to the Medicare rate, which is only just a little bit above the Medicaid rate. So that's a really significant hit to a lot of hospitals. There are two main programs in these state-directed payments. There's the Hospital Rate Improvement Program, which is for private, for and nonprofit hospitals, and then there's the University Rate Improvement Program, which is, you guessed it, for university hospitals. We think that the HRIP program is going to drop from about $2.8 billion to $400 million. We think the URIP program may go away entirely. We've got some time, right, before this is actually implemented, so we're not entirely sure, but this is kind of what we're looking at moving forward. Okay, if we go on to the next slide, there are several other cuts, including, well, this is more like a cost shift. So co-pays for individuals above the poverty line. So this is for folks between 100 and 138% of poverty. These are capped at 5% of income through the year. But 5% of income for someone making $20,000 is $1,000 a year, which is essentially a rent payment, right? I mean, that's a pretty significant amount of money that folks are going to need to live off of. It also reduces retroactive eligibility. If you want to know more about that, I can tell you about it. All right, let's go to the next slide. So yeah, these 35 hospitals, there was an organization out of the University of North Carolina called the Shep Center for Health Research. And what they did is they looked at all of the rural hospitals, not all hospitals, just rural hospitals, which is a special designation. And they pulled Medicare data from them, which shows payer mix. So they took the top 10% of hospitals that had the largest share of patients covered by Medicaid. And then, out of that group, they took hospitals that had negative operating margins over the last 3 years, and they came up with a list of a little over 330 hospitals nationwide. 35 of those hospitals were here in Kentucky. Now, I just want to clear something up real quickly. They did not say 35 rural hospitals are going to close in Kentucky, which I think is what people have heard a lot. what they said is that 35 rural hospitals are an enhanced financial risk, which means they may have to lay people off, they may close certain services, and then eventually maybe they would have to close their doors. I've talked to hospital administrators who represent several of these hospitals, and they've said things to me like, well, I'm not really worried about the hospital they listed, but there were 2 others I am pretty worried about. So I think the point here is that it's going to have a really profound impact on rural hospitals, not that, it's these specific hospitals that are at risk. In any case, we know that hospitals are pulling back, right, in the face of these cuts. They have not been implemented yet, so we haven't seen the full extent of it. But in, places like the University of Louisville, they already announced, hey, we're not going to open up this birthing center that we plan to open because we don't think that we'll have the finances to meet it due to these Medicaid cuts. And I think that's the kind of thing we're going to see. Some of these more expensive types of services getting pulled back. Maybe we'll see some layoffs, and then eventually down the line, you might see hospital closures. So, I do think it's important to recognize that, this is healthcare capacity, right? I mean, these are hospitals that don't just serve people on Medicaid, they serve everybody in the community. And so those services going away mean that there's a longer commute time. And we know from a lot of research that the further you have to drive to a hospital, the worse your health conditions can get. Because you skip appointments, it takes longer to deal with stuff when there's an urgent need, and so forth. Now, there was a part of the bill that included extra money specifically designed to help rural health. It wasn't designed to supplement rural hospitals specifically, but to try and address some of the shortcomings that we as a state saw. So this Rural Health Transformation Fund, actually there was just an announcement that Kentucky was awarded the first amount out of 5 years. We got, I think it was $212 million for this coming year. So if that holds true, we'll probably get about $1 billion over the course of 5 years. And actually, if you want to look it up, you can just look up Kentucky Rural Health Transformation Fund. You can read the plan. There's sort of 5 domains around things like chronic conditions and dental health and behavioral health and so forth. If we didn't have a massive Medicaid cut, it would actually be a pretty fantastic program. So the things we're doing with it, the amount of money we're getting, it's really good. It's just not enough to make up for what we anticipate losing. So, I just mentioned, it's about $212 million this year. If that holds up over the next 5 years, it'll be about $1 billion. But if we go to the next slide, while this bill was being debated, Kaiser Family Foundation tried to figure out what the cut to rural areas would be. And this line here is not the y-axis. That's Kentucky. And it's about $10.9 billion over 10 years. So the Rural Health Transformation Fund, we might get $1 billion over 5 years, but we're likely to lose about almost $11 billion over 10 years as a state. So it's not enough to make up for sort of the funding losses. And remember earlier I said Eastern Kentucky payments to providers make up about 13.5% of GDP there. So not only are we talking about a potential loss of coverage, which is a real issue that, nonprofits are going to be the ones sort of dealing with the fallout from, we're also talking about potential job losses that come along with that. So it's something to look out for. And the other thing I should mention is those are only rural hospitals we were talking about. I'm not even talking about urban hospitals because I don't have research about urban hospitals. But we know that they're going to lose some funding as well. Okay, let's move on to the next slide. Real quick, talking about the marketplace. So, there was a set of enhanced subsidies that were passed through the American Rescue Plan Act and then were extended through the Inflation Reduction Act back in 2021 and 22. Those were really beneficial. It allowed a lot of people to have $0 premiums. It allowed a lot of higher income folks who were uninsured to get insurance for the first time. So think like a small business owner who only, either works for themselves or only has 1 or 2 employees. It's really difficult to buy health insurance for a small business. And so this was a good opportunity for them to be able to buy health insurance. But those enhanced subsidies expired. There was a big government shutdown a few months ago, that was around trying to extend these, and that didn't happen. So, at this point, open enrollment is closed, and unless Congress acts quickly, this is the sort of picture that we're going to be looking at for the next year. We know that about 10,000 folks have already actively disenrolled, but moving forward, there's going to be additional steps that people have to take in order to get enrolled on the marketplace, starting this upcoming open enrollment season in November of this year. That includes things like pre-verification. People won't be able to passively enroll anymore, which means if you do nothing, you just get rolled over into the next plan. It's going to eliminate the special open enrollment period for low-income individuals. And if you are disenrolled from Medicaid because you failed to meet the work requirement there, you will also be ineligible for marketplace subsidies. That's the other kicker. All right, let's move on to SNAP, if that wasn't depressing enough. So there were several changes to SNAP as well. We think that, again, additional paperwork barriers related to the work requirement could lead to a lot of folks losing coverage. There's a very large potential shift in cost to our state budget. And then we think that a lot more folks could see reductions in their benefits over time. So I'm going to run through these. And I should say, too, I sent my slides to you all. So I'm happy if you want to send these out and people can look at them later. But yeah, just to start with, there's over 500,000 Kentuckians, almost 600,000 who use SNAP every day. We work really closely with Feeding Kentucky. Sounds like several of you know them well. They would remind you that, SNAP provides 9 meals for every one that Kentucky food banks can provide. And Kentucky food banks provide a lot of meals, if that tells you just how important SNAP is in sort of the food landscape in Kentucky. 40% of them are children, and it brings in about $1.3 billion in federal funds every year to Kentucky. So, to start with, there was an expansion of the work requirement in SNAP. People between 18 and 64 now have to adhere to this. Again, that rule about kids 14 and up applies. So, if you have a child age 0 to 13, you don't have to adhere to this requirement. 14 and up, you do. It used to be that, we were only talking about childless adults, and now we're talking about adults without teenagers, I guess. We think around 64,000 Kentuckians will have to adhere to this, both because of the expansion and because we got rid of most of the county-level waivers of this. So it used to be that if counties had an unemployment rate 20% higher than the national average over the last 2 years, then that county could be waived. And we had 117 counties in Kentucky that met that definition until November. 117 counties waivers expired, and now this requirement is statewide. In some counties, for the first time ever, right? Because this policy went into place 30 years ago after the 96 Welfare Reform Act. There's 8 counties in southeastern Kentucky that never had to deal with this because they have persistent high unemployment. They will have to start doing that for the first time, despite persistently high unemployment. All right, next slide. There's several cost shifts, both with administration and the cost of the benefits themselves, that the state's going to have to deal with. Right now, the cost of the benefits themselves, that cost shift is based off something called an error rate, which is just how accurate the state is at giving the right amount of money to folks, because it's prorated based off of income. Right now, our error rate is low enough that we don't think we're going to have a cost share for this upcoming biennium. But we're not through the year yet, so we'll see. But we will have to pay more in administration for sure. And this is something the governor and the legislature have sort of agreed upon ahead of time. There's other cuts, again, based off of immigration status. It ends the internet deduction for benefits. It also could reduce the value of the benefits over time through a change to what's called the Thrifty Food Plan, which is how the maximum benefit level is set. If we go to the next slide. Yeah, okay. The one thing that the H.R. 1 bill really did help with or benefit is large tax cuts. Unfortunately, those large tax cuts primarily only benefit wealthy people. So this is a look at sort of the distribution of those tax cuts based off of income. If you go this way, we're talking about the bottom 20% of earners. If we go this way, we're talking about the top 20% of earners. And as you can see, the top 20% of earners, so anybody earning $148,000 in Kentucky or more, they're going to receive 64% of the total value of those tax cuts. For folks at the bottom, it's about 1% of the value of those tax cuts. And no surprise, we're talking about folks who are earning very little, and so they're not going to receive much back in those income tax cuts and other types of tax cuts. If we go to the next slide, this is how it shakes out in terms of dollars, right? So if you are in the top 1% in Kentucky, you earn over about $650,000. Your tax cut's going to be about $46,000 a year, right? That's like a new car, If you earn at the bottom 20%, so you less than $25,700, likely mostly the folks you're working with on a day-to-day basis, you're getting a tax cut of about $70 per year. Yes, Lisa. They're not paying state taxes. And they're probably not paying many federal taxes, if any. But they might have, payroll tax, and then they get some back through, an earned income tax credit, child tax credit, and so forth. But yeah, the total value of their annual tax cut from HR 1 is about $70. Break that into 24 payments, and it's hard to notice. There is a real sort of winners-losers scenario here. I didn't include it here, but there's a distribution chart that the Congressional Budget Office put together that showed that, the combined cuts to SNAP and Medicaid for the bottom 20% dwarfed any kind of tax advantage that they may have. It's a really pretty significant change. So I mentioned earlier, not all of these things are going to be implemented all at once. They're not all in effect right now. They're sort of happening over time. So, some things have already happened, like the change to immigration status on the marketplace and in Medicaid. The SNAP administrative cost increase is going to be implemented this year, actually, in October. If we go to the next slide, looking further out, Medicaid work reporting requirements are going to start at the beginning of next year. So about this time next year, we're going to be dealing with that. The SNAP cost share requirement is going to happen next year. And then a couple years out, we're going to see things like the change to the state-directed payments and then the new co-pays in Medicaid. So, what that tells me is a couple things. One, there's a lot of time for us or you all as direct service providers to prepare for that, right? So this is not all going to happen all at once. But two, there's also time for our state government to prepare for that. Who knows what's going to happen in Congress? They could change their mind. There could be changes in the composition. But I think we shouldn't bank on that, right? What we do have a little bit of impact on is here at home, right? What can we do to prepare for this? How can we move ahead? So just to start out with, this is a budget year in Kentucky. We're going to be deciding how our state spends money for the next 2 years. I'm also the finance chair at my church, and so every time I get up, with my church and I talk about our church budget, I say, the budget's a moral document. It's a statement about what we value. And so the same is true at the state level, right? It's a moral document. I've heard someone say, don't tell me what you value, show me your budget and I'll tell you what you value. And so that's something we're going to be having discussions about. Now, unfortunately, we had a little bit of time here where we had a lot more revenue than we had in the past. This was during 2021 and 2022 when there was a ton of federal money coming into the state and there was higher inflation, right? So wages shot up, but so did sales taxes, right? Because sales tax is just 6% of what we buy. And when prices go up, that 6% is worth a lot more. So we had a couple years where we had a lot of cash on hand, but that's starting to dip for a few reasons. One, that federal money has dried up. Two, inflation has calmed down. It's not back to where it needs to be, but it's much, much lower than it was. And three, we've been cutting the individual income tax in Kentucky. We've cut it by 1.5 percentage points, from 5% to 3.5%. In fact, the most recent tax cut just went into effect this last paycheck for most of us. Did anybody notice it? No, nobody. Nobody noticed their 0.5% increase in their income. Okay. Well, I'm going to come back to that here in just a minute. you know, our individual income tax used to be one of our largest sources of revenue, but it has actually since dropped and been eclipsed by the sales tax because we've been reducing it. Every half percentage point reduction in the income tax is $718 million that we're not bringing in. We've done that 3 times now, which means that we are now bringing in $2.1 billion less as a state than we would have had we done nothing. Now, $2.1 billion, it's like a big abstract number, but you know, our total general fund is only about $16 billion. So, you know, there's a real question about, you know, priorities, right? If this budget is a statement about what we value, you know, then we're continuing to erode that budget so we have less to be able to use toward the things that we value. If we go on to the next slide, one thing I just want to say, though, is that, you know, when we had that surplus there in 21 and 22, that money didn't just disappear, right? We didn't spend all of it. We put it in what's called our Budget Reserve Trust Fund. Sometimes it's called the Rainy Day Fund. This dotted yellow line is what most economists and sort of public budgeting experts agree is a good level to have, right, in savings to make sure that, you know, if there is a downturn, we have some money in our Budget Reserve Trust Fund so that we can weather those without having to cut services. And as you can see, for the history of the Budget Reserve Trust Fund, we didn't do a great job. In fact, some years it went negative after the Great Recession. However, we started putting that money away in part because that was how we planned to deal with the tax cuts that the General Assembly wanted to do. And now we have got about 24% of it, 24% of our general fund sitting in the Budget Reserve Trust Fund. That's about $3.7 billion. That's a lot of money that we can use to deal with a lot of the needs that we have as state and increasing needs that we're going to have because of these federal decisions that have made that push a lot of the cost to the state level. So the question I think this year is, are they going to do it again, right? Are we going to keep cutting the income tax so that we have less revenue to be able to deal with the things that we care about? We did some polling recently of 2,000 Kentuckians, right? Republicans, Democrats, independents, men, women, all parts of the state. You know, usually polls in Kentucky have between 400 and 700 people, so 2,000 is a pretty decent sample size. And what we found is most people, like you all said, didn't actually notice their tax cut, right? So 9% of Kentuckians said that those tax cuts are helping them personally. 9%, less than 1 in 10. However, something like 8% said they actually hurt, and 40% said they haven't affected them whatsoever. What it does affect is our ability to weather large federal changes, to weather economic downturns, and so forth. We asked them, you know, well, okay, so this year, actually, the state doesn't expect to bring in enough money to cover its bills. We're going to have to close that gap somehow. How do you want to do that? If you were in charge, how would you close that gap? Would you make cuts to schools, healthcare, and other public services? And about a third, a little less than a third, said yes. But most folks said, actually, I'd rather generate more revenue by raising taxes on the wealthy. Not even as much as they've gained through recent tax cuts, just enough to kind of make sure that we can get by. So I know that we don't often think of taxes as safety net policy, but in a very real way, revenue matters, right? Our ability to pay our bills matters. And when we start providing tax cuts that primarily benefit the wealthy, that's great. It's good for them, you know, like more power to you. But it means that we have less to pay for the things that everyone else needs. The services that the folks you all care for use on a day-to-day basis to get by. The public education that we provide to make sure that the next generation is where they need to be. So, you know, I'm not here to necessarily say here's what our tax level should be or to make the case for a particular tax policy, but I do think it's important as providers of direct services that we recognize the connection between these things. So few things that are, you know, sort of coming down the pike, and then I'll stop there and take questions. You know, we have to deal with the outcome of H.R. 1 through a lot of administrative policy. So this governor and the governor after him, whoever that is going to have to implement the way these policies are run. And, you know, we can implement policies that keep more people covered or less people covered? And there's a lot of sort of decision making that will have to happen when we get to that point. We need to avoid harmful state budget cuts, right? We need to make sure that the services that we have are not cut at the very least, let alone expanded. We should also probably use some of that budget, not all of it, but some of that budget reserve trust fund to fill the gaps that we have right now. We still need some of that in there, but probably $3.7 billion is too much. I think we need to make sure that we stop additional state tax cuts so that we kind of stabilize and we know how much we have to work with on a year-to-year basis. We don't let another $718 million out of our budget go. And then finally, I think we need to sort of start advocating for alternatives, right? We can only cut so much before there's nothing left. We need to make sure that we, as a state and society, are taking care of folks. So I'm going to pause there and see if there's any questions. It's 1:45.
Is there any data that was looked at for the work requirements for SNAP or Medicaid of how many nonprofit volunteer hours we all have to make room in the inn for all of those folks that are going to be implicated with that? Because this is what's always hurt us when we have these state-based things is Be Concerned doesn't have 5,000 more volunteer hours. And for some reason, none of us in this room ever get reached out to by our politicians or anyone we make changes. But that's my big fear is with the work requirements. We can say there's that many job opportunities around here, but there's not. But my concern is how many hours are these folks going to need to serve, and can we, as the whole safety net, even facilitate it? Because last time we couldn't.
Yeah, so that you're bringing up some old memories of the Governor Bevin era. So in 2016, then Governor Bevin submitted a waiver to do something very similar to what we've now are going to have to implement in HR 1. And part of what he said was, well, our nonprofit community can provide volunteer hours enough to satisfy this requirement. Don't worry about it. I'm sure you'll remember most nonprofits said, no, we can't. we need some help, but we can't provide thousands of hours of volunteer. So the short answer is no. I think the reality is that there's actually not a ton of people who wouldn't currently meet the work requirement or the other criteria that might exempt them. The problem is the paperwork involved. So there's a really good article from a few years ago by Annie Lowry in The Atlantic called The Time Tax. If you all get a chance to read that, I highly recommend it. But basically what she's describing is something that a former administrator told me is the hassle factor, right? How difficult or easy do we make it to be able to report things to the government? And she, kind of uses examples of like the old COVID test mailing program, right? Did anybody order a COVID test on USPS back then? Yeah. Do you remember having to like put in, your social security number and how many hours of work you did and, verify your immigration set? No, you don't remember any of that because you didn't have to do any of that. You just put your address in and your name and they sent you a COVID test. As opposed to some places where, the hassle factor is much greater. So I think the issue is, how do we make sure that people can seamlessly report the things they're doing and not let them get tripped up in sort of the reporting process?
So my question goes on to the documented of disabilities, and is that something that has to be approved by Social Security, or is it just have to be documented by the doctors in order to get that kind of thing?
That's a great question. So in SNAP, you do not have to go through disability determination services. In SNAP, you have to have essentially a doctor's note, right? You have to have certain types of verification. What I've been told from the state is that for the first year, so starting the beginning of 2027, they will accept self-attestation from folks and then verify later. So there should be a button that says, yes, I have a documented disability, and that is an exemption initially, and then later you'll have to submit some kind of paperwork. After a year, I think the federal government's going to be a little more strict about what's involved with that. But at least initially, you should not have to go through, disability determination services or the Social Security Administration.
I think we have time for one more question. I'll ask a question. All these cuts, we know I'm in healthcare, but most everybody else here isn't in healthcare. A lot of us aren't in food. Can you talk about the trickle down of when you take away one benefit, how that trickles down to the other areas in the safety net and how it might hit us, even if that's not what we do?
Yeah, I mean, so I think SNAP is a great example of this, right? SNAP is the Supplemental Nutrition Assistance Program. It's meant to only make up about a third of someone's food budget, right? But we know from a lot of research that a lot of people don't use it for a third of their food budget. They might use it for a quarter of their food budget, or actually a larger portion, so that there's a substitution effect. They have a little extra money and they can use that to buy clothes for their kids to go to school, or they can use it to put gas in the tank or so forth. So when you reduce the amount of money that people have for SNAP, or you take it away altogether, you're requiring them to use a much larger share of their income on food, which means they have less money for everything else. They have less money for medicine, they have less money for education, for housing, you name it. So, what we're concerned about is that when you, again, with SNAP as an example, when you take away that income support, that very targeted income support, you're actually reducing the overall income of the household. And again, I mean, I don't have to tell you all what that means, right, in practical terms, and including adverse childhood experiences, right? There's another issue I'm working on right now related to KTAP and child support. If anyone's interested, come talk to me. But that, policy says that, we should make sure that as much child support gets to kids as possible. Right now, we're not letting all of it go through. But actually, if you let some of it go through, you reduce the likelihood that that kid is going to be involved in the child welfare system. The child welfare system is extremely expensive, right? It's very expensive per child. It's also extremely harmful for that child and for everyone else involved, especially when the issue is dependency or neglect. So, those increased costs then crowd out the rest of the budget, and then you end up with less money for education and so forth. So there's a lot of ways in which providing less support for people who need it, most of whom are working, at least part-time, but just don't have enough to get by on, really impacts the rest of their family budget, but also the rest of society. I think there are lines there, right, that we can draw that we want to make sure we're providing to folks who really need it. But there's a degree to which we're very far away from that line.
Dustin, can you guys help me in thanking Dustin?
Okay, I know a lot of what I said was depressing. So, take a deep breath. But if you really enjoy policy, if you like nerding out on wonkery, as we call it, we have a statewide policy conference that we're going to put on January 30th in Lexington. So if you are interested in joining, just head to our website. There's a big button at the top about it. Our website is kypolicy.org. Feel free to come join us. We're going to talk about a lot more than safety net. We're going to talk about immigration, education, criminal legal system issues, the state budget, and so forth. So January 30th, we'd love to have you.
Thanks for doing that work, Dustin.
Thrive first, I can tell them about Thrive.
Yeah. So Thrive Kentucky is the coalition I mentioned at the very beginning. We are a coalition of other sort of policy advocacy groups. Kentucky Voices for Health is involved, the Homeless and Housing Coalition of Kentucky, Feeding Kentucky, the Kentucky Council of Churches, several others. And we do a lot of public education, including sort of what we call the road show, where we're in person. We've been in Covington several times, went to Independence once. If you are interested, please follow any of those organizations on social media, and you'll see, about webinars coming up. In fact, we have one coming up on Tuesday, where we try to give a lot of state and federal updates on the safety net in particular. So, just reach out if you have any questions.
Awesome. Thanks. I've gone to the roadshow. It's amazing and totally worth your time. I know for a lot of us in this room, policy can feel really far away from what we sit at our desk and do every day, right? It can feel so far removed. And yet, and I hope what Dustin shared is that it impacts what you do at your desk every day. So I know most of us in this room are not big policy people. Probably most of us don't engage with our government very much. But our legislators are in session right now, and they do actually care when they get emails and they get phone calls. And so I would strongly recommend looking at KY Thrive, looking at KNN, looking at some of these other organizations that help with the SafeNet and put policy agenda out there and see what they're worried about. And if it's something that connects with you, make a phone call. You don't actually talk to the person. They're not going to answer the phone, so it's not like you have to debate them. You go to an assistant and you say, hey, I care about this. I hope they vote no, or I hope they vote yes. And then they get a sheet of paper on their desk, and they come in and they count those sheets of paper. And if there's enough, they say, oh, crap, a lot of people care about this. And I got to tell you, enough is like 20 people. That's as much as it takes to swing, because most people don't. So if we all in this room saw some things and we were like, I don't think that's a good idea, and we all reached out to our legislators from Northern Kentucky, there would be 100 sheets of paper on their desk, and I'm telling you, it would swing things. It would swing things. So it is important. It's not passive. It's not something we should just forget about. So thanks for being here, man. Let's move into, I do want to tell you, Dustin drove all the way up from Lexington to speak with us today, and all we promised him was pizza, and he didn't even eat it. So that's pretty amazing. So I hope you appreciate his time. I know I really appreciate it. Thank you. Let's move into announcements. We're running short on time, so if you got an announcement, raise your hand. Myself and Mr. Brunsman will come around and find you. I'll go this way, you go that way.
Start with Sarah.
I wrote it down this time, so I won't make a fool of myself. So next week is the K-Count. The results of the K-Count demonstrate the need for resources for housing and services for homeless persons in all of our communities. That's 120 counties, and that's also nationally. The K-Count begins on Wednesday, 28th, and goes until Friday, the 30th. This is done by completing a survey of individuals that are unhoused. It's only to provide a snapshot, so I know that it's only 3 days. Welcome House is looking for volunteers to help conduct the surveys, as well as pass out hats and gloves and non-perishable food items. If you or your organization is interested, there is an online training from KHC, that's the Kentucky Housing Corporation, and we are covering all of Kentucky. We are in need of volunteers. We are serving 118 of those counties, and you will be paired with Welcome House staff. So if you are interested, you will not be alone during this. Please come and see me.
And those counts are really important for federal funding and state dollars coming to our region. They directly impact the work you do every day.
Hi. So a change, I'm still with NKCAC, but I am now the director for the Senior Workforce Program. So we have a program if you're 55 and older, want to make a change. We actually have a grant where we can provide a certification from a college. So you go either into our paralegal program or our business finance program. So if you have any clients that would be something that would be helpful or good for them, let me know, send them to me. I've got some flyers back there. And also, most of you hopefully know, but it's LIHEAP season. We do have, NKCAC neighborhood centers do have money to help with utility bills if your client is behind on the bill. They do have to be behind on their electric bill right now. Sometimes they don't have to be this pot of money. They have to be behind on their bill. So thank you.
Hi, there will be a World Cancer Day screening event at the Latonia branch of the Kenton County Public Library on Wednesday, February 4th from 1 to 3 p.m. This is open to anyone. The Kentucky Cancer Program, Cancer Support Community, St. Elizabeth Physicians, the Northern Kentucky Health Department will be there. Melanoma No More, the American Cancer Society, but there's a lot of great opportunity to have anyone from the community come out, whether they're insured or uninsured, or either way, there's an opportunity for information, connection, and support, and it's also going to be a great opportunity to connect with other people in the community to provide that support and that ongoing care that people might need. So nurses will be there. There'll be a lot of opportunity for people to connect care gaps, and a lot of the family practice offices are going to have staff down there just to introduce themselves and meet people in the community. So there's flyers back here, and there's French, English, and Spanish flyers back here. And also, I don't see her here, but the African Women Alliance is doing a health event on February 21st from 9 to 2:30 at the Northern Kentucky Health Department in Florence. So, yes. Were you going to add to it? No, we were just focusing more on the connection to cancer care and screening. I've had a lot of people reach out, but it's our first event, and it's in a smaller kind of area too. So for this one, we're sticking this way, but we're hoping it becomes a bigger tradition. Where can we find out more about that? The cancer, there's flyers back here, and they're Spanish, English, and French.
Awesome. Who else has something today?
I do. Just there in March 17th is going to be Spring into Wellness at the Boone County Florence Library. And April 18th, there is going to be Fighting for Freedom, Human Trafficking Conference in Alexandria at Main Street Church. There will be flyers on both of those coming out.
It's cold out there. You guys know it. If you guys have clients, customers, people in your programs that need coats, we did our coat giveaway Monday at Be Concerned. We have a little bit of coats left, so you can send your families to us Monday through Friday from 12 to 3, and we'll give them a voucher so they can go get coats from downstairs in our thrift store, or we'll pick those up. I know we had kind of reality today. On a good note, Horizons Community Foundation emailed me during this meeting, and food providers that are part of the kind of that group, there's 20 of us, they have just announced they were going to fund the second round of emergency food support, which is terrific. So that's going to make a total regional impact to all safety net players of about $270,000 by the time it's all done. 135.7 last round and about 140 this time, so just north of there. But that has been what's helped a lot of us be able to keep up with demand here. So you guys will get a formal email from me with reporting all that fun stuff. But that's real good news out of the safety net because that's where it started. But that is all over $250,000 in safety net impact because of the people in this room. So thank you to all of you guys.
I'll say one other thing with that. Just like politicians care if we call, funders care if we call. So if you can drop an email to Horizon Community Funds and say, hey, thanks for giving this money, it's making a real big impact in our community, it will make a difference the next time we go to them and say we have a disaster. So think about doing that. It's you can look at their website and find an email there.
Douglas Beard, Workforce Innovation Director with Brighton Center. At your table, you do have a flyer about the New Year, New Career. That's a week from tomorrow, Kenton County Public Library in Erlanger. If you notice, the time for that is 11 to 1. Some of the feedback that we have gotten from employers is that during that time frame of the actual job fair, they want to meet with individuals who are seeking employment. I know a lot of you, because you have caseloads and you represent people, you would like to meet with employers too. What we have done is we have set up the half hour before from 10:30 to 11 for individuals in that situation to connect with employers. Now they'll be setting up and that kind of thing, but that was kind of the compromise to have that networking half hour for professionals to meet with employers because they really want to save that 11 to 1 time frame to talk directly with people who are seeking employment. Lots of employers will be there. It's about 33. Several on the bus line, several that are fair chance friendly. So please, if you know somebody looking for employment, send them to that job fair.
That's awesome. I love that you made time for that. Any other announcements today?
Hello, I'm Bethany Bruckle. I'm the district ombudsman, but I brought 2 boxes of the senior guidebooks. They just came out yesterday. And so if you want any, you can just call the Northern Kentucky Area Development District, the ad, and let them know how many boxes you want, and they will have, but there's some back there if y'all need any.
Fantastic. Anything else today? Okay, well then we will wrap up. I'll remind you of one thing, maybe 2 things before we wrap up. One, safety net alerts. Remember that you can submit those through our website, so if you have an announcement or you have a need sometime between now and the next time we meet next month, go onto our website and submit it. We'll get it sent out to everybody. If you're not on Safety Net Alerts, when you signed into today's meeting, you had the option to sign up for them. I hope you will get on those because they matter. And then, lastly, walking out of this place, I think we heard today your job just got harder, but that only means your job is more important. So please keep doing the hard work because I know our community needs us. Thanks so much. We'll see you next month.